coordinating safe and timely discharge through real-time visibility. The hospital is coming to life after a relatively quiet night. Morning routines are underway across the wards. At the daily 9 a.m. ward staff meeting, one of the key priorities is to review patients who may be ready for discharge and identify what is needed to enable them to leave hospital later that day. Communication and coordination with community care services are an important part of this process. Dan has spent several days in the acute medical ward and is one of the patients who may be ready to leave the hospital. The nurse confirms that Dan is ready for discharge. At the community team, a care coordinator can immediately see that Dan is ready for discharge. It has not yet been decided whether he will return home or require a short-term care placement. Dan's needs are assessed using the latest information from the hospital together with current service availability across the community. It is agreed that Dan will be offered a short-term care placement with a bed available from 2 p.m. that afternoon. The care coordinator updates the relevant status information and notifies the receiving care service that Dan will be arriving. The information is shared instantly and becomes immediately visible to the hospital team. The ward nurse can now see that follow-up care has been arranged and that Dan has been allocated a short-term care placement. She books patient transport directly from the digital whiteboard application and informs Dan that he will be discharged at around 2 p.m. and transferred to the care facility. This enables the hospital to discharge Dan without delay, while ensuring that community care services have the information they need to assess, coordinate, and deliver the support he requires after leaving hospital. By providing a shared real-time view across health and community care, discharge decisions can be made more efficiently, helping patients move to the right care setting at the right time.